Hello, Gary Crowley here with ankle joint pain relief, step 1. And basically in step 1 we're going to release this big long shin muscle that connects down into your ankle. We're going to release the muscle on the top of your foot here that connects to the other side of your ankle. And we're going to release something you maybe never thought of called your retinaculum, which is basically a big ace bandage that wraps under your skin, that kind of wraps all the tendons and everything together to keep them in place so that your foot and ankle can actually work. So step 1, we're going to release your shin muscle here, and you can do this either seated or lying. And basically, like everywhere else, I'm going to use the hand-on-hand technique. I'm going to poke around for some tender spots from here to here, and I'm either going to do the press, pull, release, or I'm going to do the press, hold, move. And I'll probably do a little of both, just giving my brain as much information as I can to release this tight tissue. I'm going to do that from here to here, and then you will move on to step 2, where you're going to do this muscle on the top of your foot. You're going to cross your foot over your leg, and I find getting basically both my hands on this muscle, one from under, one from over. I can get my fingertips in that tissue, roll your foot around, move your toes, especially flex your toes back, and you'll feel the tender spots in that tissue. And as it lets go, you can move on, and you can even cheat a little bit and do what it's a forced press hold move, but I'm moving my foot with my other hand. Just to get that tissue to move a little bit more and release. So there it goes on me. But that's a press hold move, or just a press pull release. As that lets go, your ankle is going to have a little more room to function. Now lastly, we're going to work on something called your retinaculum. Your retinaculum is basically like an ace bandage under your skin holding all this stuff together. And sometimes it gets a little stuck and things can get kind of adhered to it. So you just want to feel all around here for any tender spots, even on your heel bone here. Sometimes it can get tender there. You just do a press hold move on that a little bit, press pull release on that with your thumb. Come back up here, like up in here for me, a little tight right here, so I'm going to do a press hold move on that. Get that. Now that's going to allow my calcaneus, my heel bone, to just, probably a 32nd of an inch difference, but sometimes that can make all the difference of whether your joint can function well or not. See, now that tight spot just let go, just from doing a press hold move on that. You can also do a press pull release. Do the other side with your fingertips to get in there. Now that's tight back there too, so I'm going to do a little press hold move on that. I'm doing this underside of my heel. It's pretty good actually. So yeah, my heel bone is just a little stuck, and I'm not in pain with it, but honestly now my foot will probably work just that much better because everything has the space and freedom it wants to move. Then you want to come up here. I know we did the shin muscle, but focusing a little more on that, just noticing any other tender spots. Do the press hold move there, out here. You do a little press hold move out here, and we're just focusing on that retinaculum. Actually here you're going to get your tibialis posterior, which is also a good muscle, and actually we're going to add that in. I'm just going to make sure you get that part, and it's just a press hold move. I'm using both my thumbs in there. That's probably the best way to get at it. And again, you can lie down and do this. You can lie down and do any of this. Actually, this is a little better lying down. Can really get my thumbs into my tibialis posterior. And so yeah, we're going to add this to the equation. I thought it was a little hard for you to get at, but now that I'm doing it, I think you can do it. So that's a good one. All right, so that is step 1 of ankle joint pain relief. So give it a shot, put some time in, take your time. Be patient, and that tissue will let go, and I look forward to hearing how it goes. Thanks. Bye-bye.